Hello, this is Dr. David Pomeroy, your host of the podcast ADHD Focus. And now we're also in video on YouTube and on the Experts and Authors TV channels on Roku and Fire Stick. And I'm very glad to have, to me, a special guest today. Cynthia Hammer is the founder of the Inattentive ADHD Coalition. The website is iadhd.org. It is the second nonprofit about ADHD, which Cynthia has founded and started. She founded ADD Resources back in the mid-1990s. And this was the purpose of educating people about ADHD because she found after her diagnosis that it was very hard to get information about it. And I had the pleasure of being involved with ADD Resources for a number of years, and now glad to reconnect with Cynthia in her new venture. So, Cynthia, thanks for joining us.
Thank you, David.
So we've decided to look at the overall topic of girls and ADHD, both inattentive and the combined type, which is inattentive and hyperactive. But first, we wanted to talk about the confusion in terms of the official diagnostic label of ADHD, separated into primarily inattentive and combined, and how that perpetuates kind of the myth in many people's minds that, oh, you have to have the hyperactivity to have the disorder. Have you found that to be true, Cynthia, in people you've talked to as far as this confusion?
I don't know about that. I just think having the name hyperactivity, when they explain that it means we all have hyperactive minds, I think that is getting very esoteric. It's not how most people think of hyperactivity. They think it means you have a physically hyperactive body. And those of us with the inattentive type of ADHD do not have the physically hyperactive body. I know that, in fact, from having interviewed women with hyperactivity, and they talk like they always need one part of their body to be in motion.
Or talking fast, and agree, certainly by mid-late high school, most even boys, and the myth that was in the 1990s and before was that only boys, hyperactive boys, have ADHD and they outgrow it. Well, no, they don't outgrow it. By high school, you're kind of socialized that you don't get up and move around in the classroom, and you aren't disruptive, but your mind might be going. You play 3 sports, and it's particularly the mind going really fast that's the hyperactive part often in adults, and some body part moving or talking fast, those kinds of things, that the hyperactive part shows up differently.
It just seems somehow, I don't know if it's from how the condition first was described, but it's so much in the public knowledge of this image that it's someone that's physically hyperactive and disruptive in the classroom. And to try to move that image to a wider frame of reference so that it includes these other people, boys as well as girls, who are not physically hyperactive. It's a very hard thing to do. And especially when the name of it continues to include that word. So there's a lot of people out there that dislike the name ADHD for a lot of reasons. But the reason I've come to dislike it is because it has that word hyperactivity in there, and it totally negates those of us with the condition who don't present with that aspect of it.
Exactly. And it may be well and good in academic research to then have this qualifier of, well, it's ADHD, primarily inattentive, primarily combined. But that last part is left out. You just see, oh, the diagnosis is ADHD. And it definitely is confusing.
Well, in a way, it doesn't really matter. I've read that the medicines are the same, whichever type presentation you
Mhm.
have. Dr. Dodson says maybe the inattentive type needs a little smaller dose. I don't know if that's true, but where the problem is in the image it creates. And so
Yes.
it combined, it contributes, I should say, to the underdiagnosed of those that have inattentive ADHD. And you can tell me if I have this wrong, but the children who do get diagnosed are diagnosed by age 7. But that's not covering all the children we're figuring out now who did not get diagnosed. And the predominance of the ones that aren't getting diagnosed are those with the inattentive ADHD or females who were hyperactive, but they suppressed it because the culture gives them such a strong message that we don't like girls that are too wild, too energetic, too active. And so they
Well,
work to suppress it.
I think the diagnosis by age 7 isn't isn't accurate. Partly that's why in the new diagnostic criteria, it was expanded up to, well, it could be up to 8 behaviors or traits of ADHD that were present before age 12 was part of the criteria for diagnosis. This was in 2013 with the DSM, the Diagnostic Manual for Psychiatric Psychological Conditions. But in my experience, even age 12 doesn't pick up on, I think, the obvious, more obvious to everybody issues. That is, a child can do fine in elementary school. They're intelligent and it seems pretty easy. And they have one teacher and there's established, here's when you do the homework, and the teacher reminds you. You get to middle school, they have 5 teachers. They have different times, different assignments are due, and their inability to plan and organize, that shows up. And I think that's true throughout, in terms of it becoming obvious, because it's when the life situation overwhelms the executive functions or the ones that don't work well.
Well, I guess we could have an intellectual conversation about this because I
Yeah.
don't think it shows up. I think it's a condition you're born with, and the
Oh, yeah.
problem is people aren't recognizing it early enough. And so they say by age 12 because that's when they're starting to see it in people. People are starting middle
Right.
school and their life gets harder.
Right.
But if they knew what to look for, they could recognize it earlier. That's my position.
Um,
If I mean,
well,
Dr. Orrin Mason
say,
told me he felt comfortable diagnosing children by the age of 7. And so if
I
someone
feel
came in,
comfortable doing it, but I think there are still people and children that it's not so obvious. Maybe it's there if people knew what to look for, but then there are these myths that, oh, well, you're doing fine, you have good grades, you're, well behaved. That is, the teacher wouldn't know you're daydreaming because you're not causing the problems of the disruptive kids that
right. But
draw that teacher's
but what we're
attention.
hearing from these people is that delayed diagnosis has negative impacts.
Oh,
And
absolutely.
so
Absolutely.
we shouldn't accept it. We shouldn't say, oh, it's okay to diagnose by age 12 because you've already had a child living 5 or
Yeah.
6 years of their life thinking they're different, thinking they don't fit in, thinking I
Yes,
have
I
to
agree.
try hard to be
I'm not
acceptable.
I'm not saying that um we ignore it or say, you wait until age 12. I'm just thinking all of the types of things that can bring out the symptoms are not always evident by age 7. Some are, but organization, parents are the kind of executive function of children who are 5, 6, and 7. So you wouldn't, it's not expected that, okay, the child is going to know when the math packet is due and have it in their backpack and remember to turn it in. Certainly happens. And a child who gets it done, gets the homework done and doesn't turn it in, to me is a big red flag that ADHD may be there. But I don't think the child is expected to remember that, do that until later grades than
Right. Yeah.
first or second.
Well,
So
I don't have the knowledge with so many individuals. Where my knowledge comes from is to listening to people who have the knowledge. So it's a
mhm,
double interpretation, but my feeling is that there's a bell-shaped curve to children's behavior in the classroom, and the teacher could pick out the children who are on the tail end of the bell curve. And that a psychologist told me that she could go into a classroom and observe for an hour and pick out the children,
oh yeah,
pick out
a
the children.
psychologist can, but teachers aren't trained how to. And so you say they could pick it out. And I think that's another whole section where teachers, in a recent survey, the teachers, many of them, I think 40 or 50% said, I don't know anything about ADHD. I certainly wasn't taught any. And I think that's a shortcoming of the training of teachers. Why isn't any behavioral kind of thing trying to distinguish learning disorders, ADHD, particularly with the impact it has? Why isn't that part of the basic education part a teacher gets?
Well, I
Much
think a
less
lot of
a
that is
class or two.
a lot of that is what we're helping to evolve, and that
Mhm,
there's this growing awareness of neurodivergence, and that maybe 20% of the population have neurodivergent conditions like ADHD, autism, Tourette's. I think OCD is on that,
mhm,
and we find it challenging to fit into the neuronormal expectations.
mhm,
So there's this whole wave coming now of creating universal design, inclusive design, so that just like we've learned with handicap, we build ramps, we build elevators,
mhm,
we incorporate um, people to interpret for the deaf. So we've learned how to expand what we offer so it's a more inclusive, and that this whole movement coming forward, that there's a group of us who haven't felt included, and that if you make
mhm.
some simple adjustments and just open up how you accept people, we're going to feel a lot more welcomed and less stigmatized. And I think that's a part of a whole new learning that businesses are engaged in now, and schools are going to have to be engaged in. And so we're not at that point now where we can say, point out these children that have the neurodivergence, but I think it's coming, and we need to help them to learn earlier, because that is when they're going to
Yes,
start thriving in life. We can't accept
right,
how it is now with adults
right.
getting diagnosed at 80, 50, in their
And
50s, and regretting their life.
right.
We need to
And
develop the knowledge so we can identify these children early. And when I mean early, I mean by 7 years old, because that is when they're starting their school history. Some of them are very intelligent and maybe they can get by, but they're telling us they still suffered.
oh yeah, yeah. Now part of the problem, and I think there's going to be a lag time here where even if someone's diagnosed at age 7 now, someone who's now 45,
Oh, sure.
there weren't even the diagnostic criteria until 1993 that started to say, oh, this attention hyperactivity is real. Before that, it was minimal brain dysfunction, or my mother was a counselor and therapist and worked with children, and I can remember.
Yeah.
And this was in probably around 1970. She said, "We just don't know what to do with these kids that have this minimal brain dysfunction."
Hmm.
And that's the best anybody could explain it. There wasn't a kind of um, coalition of, or a number of people talking about it. Gee, this is what we could call it. So someone who's now 35, when they were 7, 37, so I can do the math more easily. So it would have been 1993 or so.
Hmm.
The diagnosis is an official published thing came out. Most psychiatrists, much less primary care docs,
Right.
that doesn't percolate down for a long time. And doctors have the same myth conceptions as everyone else. Oh, it doesn't exist. You aren't hyperactive. You've got good grades. It couldn't be ADD. So
Right.
it is going to take a lag time. But I 100% agree with you that neurodivergence needs to be recognized,
Mhm.
and even learning disorders I can
Yes. Right.
put into that, because yeah, dyslexia is because of the way your brain processes things.
Hmm.
That's divergence from the neurotypical, and
Right.
accommodations are starting to be recognized. Sometimes it's a lot more difficult to get them, uh, but
Well, the other thing, and I don't know for autism what I think autism's highly genetic too, but ADHD is highly genetic. And so if we increase the number of children that get diagnosed, and we say as soon as a child gets diagnosed with this, we recommend screening to the parents,
Mhm, mhm,
that is going to help. So
right. Oh,
when
I
I interviewed
agree.
these 25 women, some of them found out after their child got diagnosed. Some of them, thankfully, found out during COVID because they watched TikTok and Instagram. And that,
Mhm,
it gets criticized, but I have to say, good for them, because at least out of
yeah.
25 women, the ones that offered to get interviewed by me, so I'm not saying
Hmm.
it's a true sample, but a third of them said they only recently learned because of something they saw on TikTok or Instagram. So
Yeah,
um, the
and
there
I
is
think
this
that's
there's this whole group, and the other thing I like to think about the group is, I don't know if you agree with this, but we say that only 20% of adults have been diagnosed with ADHD,
the ones
and
of the ones who have it. Yes,
and I think it's the more intelligent ones that have been
who have been
diagnosed.
or have not been.
It's the intelligent ones who got diagnosed, because they say, why aren't I performing better? I know I'm smart. Why am I continuing to have problems in life? Or they're the ones that have the money to go get the diagnosis. And I think when we go around and say that people with ADD are really bright, we're looking at a skewed sample. Because I agree
Yeah.
with Dr. Barkley, the intelligence is separate
Oh,
from the
well,
ADHD.
yeah. And I
And
think most
we're not
people
talking
do.
about the ones that are in jail, the ones that are
Mhm.
struggling in
Yeah,
life, the ones that are on SSI. You know, I just think that there's a lot of us that we have a skewed image of what ADHD is like when we only look at adults who have been diagnosed.
that's true. I don't think that, in my experience, ones who are intelligence, intelligent aren't the only ones who get diagnosed.
Mm.
Um, there are people that they may be diagnosed, but because they've had a problem at work, they've been written up. Now they have 3 jobs. Their intelligence, but it's not their intelligence that leads them to seek diagnosis. It's the fact that,
Someone else was
yes,
alerting them
someone
to
else
it.
sees it, or they're
Uh-huh.
their spouse says, how you've had all these different jobs. Or in many people, it's yes, my child got diagnosed, so I wanted to look at it, but they're not
Oh.
people that have, an IQ of 120 or higher. So
So,
it
so you
is
don't think the
but
20% are the more
I do, but I don't
oh,
think that 20% are mostly
exclusive?
the intelligent,
Yeah.
higher IQ people. I
Yeah.
do absolutely think is that the figures I've seen 25% of adults who actually have ADHD, only about a quarter of them have been diagnosed. So 4% of the population of adults have ADHD. Um,
Say that again.
so,
I think I got
so,
lost. I lost in
okay,
what you said.
4% of the adults in the United States, Scandinavian countries, Brazil, Italy, Australia, China, and that's research is in all of those countries. It's not just in the US, but 4% of adults have ADHD. So if the population of the US is somewhere around 330, 350 million, well, that's many, many people that have ADHD, but it's not recognized. A
Hmm.
recent survey that done figured that
Oh,
60 to 70% of people in prisons have ADHD. And yeah, that's not unusual with impulsive behavior, um, all kinds of different things, and substance abuse, addictions, a
yeah.
way
When
to
you think
escape.
something's a good idea and later you realize it wasn't a good idea.
Yeah, the keys are in that car. Let's see how a Ferrari is driving, or speeding tickets and then causing danger, or having guns and getting upset with someone, or just beating the heck
Right.
out of someone with
Yeah. I mean, Dr.
fists or
Hallowell
anything
used to
else.
talk if you have ADD, you shouldn't have sharp knives in your family. And I thought, boy, that's extreme. But
Yeah.
if you have
Uh,
that impulsivity,
yes. Yeah. The impulsivity makes for, and I worry about some kids when they're 12, 13, 14, and they're not just pushing someone, but they're beating up someone, or they're really insulting someone. You get to be 18, 19, you're an adult and you're going to be held responsible for smashing someone's car to pieces or beating
yes.
them up.
Hmm.
Um, so it's very uh, difficult to see that it has been underdiagnosed, and I see this in so many kids and behaviors. One fellow was, I think he was about 8 or 9, and he was so frustrated during a test that he threw his pencil on the floor. The teacher perceived that to be early violent behavior, emptied the classroom because he was violent. And this whole thing about let's have a behavior
Oh,
plan,
oh my
and because of
gosh.
this
Oh,
violent kid,
oh,
he's not trying to hurt anybody. He was upset that he couldn't do the test. And I think just starting to see things that unfortunately not in educational or in the education system of these behavior plans, and someone's misbehaving. It's not because they're a violent person. They are acting out the fact that they're frustrated
yeah,
or they're
yeah,
angry. But an 8-year-old can't express that in words. Well, I'm angry because I couldn't catch up on the test.
yeah,
They're going to
yeah.
show it. Um,
So I want to, what is, you, I assume that you've had young children where the family refuses to medicate them and others that do. Can you talk
mhm.
about the path that puts the child on, or what happens?
Yeah. Um, I'm thinking of one woman who's now, I think, 52, and I've seen her for about 4 years. She said she was diagnosed quite early, and her mother said, no child of mine is going to be put on addicting medicines. And my view on that, little sidebar, is yes, amphetamines are addicting to people who don't have ADHD. Someone who's taking it as prescribed, diagnosed with ADHD, they generally have it. They're taking an amphetamine for it. If they take more than what helps them, it doesn't feel good. There's no incentive to keep taking more. They don't get a euphoria. They have a headache or their heart's going 150 beats a minute and it's uncomfortable, or they just feel really not okay. So they cut back down to the amount that works for their focus. It's great. They're going to get addicted to it.
Well,
I
I'm not
think in
talking
my
about the addiction.
practice,
I'm talking about how it helps the child or not helps the
yes,
child to be on
yes.
medication.
And well, part of the reason a child doesn't get on it is parents again
Have a
have
myth. They believe a
have a
myth.
myth, and this myth information, and those medications are terrible. They aren't, when they're used appropriately, prescribed to someone who actually has ADHD. So this person, I diagnosed, I think, when she was about 48, and really small amount, 10 milligrams of an Adderall tablet twice a day. She said, it's changed my life. I was able to go from a structured working for an organization as a social worker slash therapist to being independent in practice and being able to manage the billing and patients. And she said, this is a new life. And she's
That's what
still
I
angry
was
at her
told when I got
mother.
diagnosed. They said, you'll be living a whole new life. But I'm wondering, if a parent does not accept medication for their child, are you still able to help that child in any way?
Yes, there definitely are systems and structured support that can help. Education of parents, and I say read things about it. I'm not I'm not saying you have to put your child on medication. That's not my choice. But I want to give you information about it. And we know that medication is the thing that makes the most difference. And I look at the kinds of thing that can help as a tripod. You have to have uh, medication so that people can pay attention to learn the strategies, and you have to get good sleep and get exercise and avoid red food dye. And there's some things nutritionally too. But the basic sleep and exercise, the strategies, having a planner, write things down, have someone to that you can commit, kind of an accountability person, and medication. If you don't have all three, it's not going to work.
Yeah.
So there's, and supplements work to some degree. They don't address the actual neurologic problem that's going on. There are various, I'd say, technological things that can help train brain to focus better. But the problem with those is a lot of them do great in the lab, great, your working memory has improved, but you still don't remember to turn in your homework. So in the practical world, it doesn't. It may make a difference if they're doing it for 2 or 3 years,
Oh,
but
yeah.
that's a long time. Meanwhile, they're flunking out of school, they're flunking classes, they're being ostracized by their peers. They get this belief that I'm bad as a person. And I think that's the worst part. It's not that my behavior doesn't fit, but I'm bad, I'm defective. And then that trips into shame. And I think shame is a huge, huge part of people dealing with ADHD. So, in your experience, and you've interviewed recently, had interviewed, I think it was 25 women with the combined type, but have had many contacts with other people in the inattentive type. So let's turn our, I guess, attention to girls with ADHD.
One thing I wanted to bring up on that
Yeah.
is I heard Dr. Barkley say that there's no mental health condition that has as effective treatments as we have for ADHD. That if someone
It's
had
very,
bipolar or depression or anything else, their treatments, their ability to find a medicine that makes a difference is not as great as people with
oh, yeah,
ADHD. So we are
it's much more
fortunate,
difficult.
and it's more unfortunate when people don't realize that this could be the golden ticket in a way. It's not
Yeah,
the panacea, but
right.
it
But
it
it's
makes your
definitely
brain
necessary.
function more normally. And who doesn't
Yes,
want a brain that's functioning optimally?
exactly, exactly. And I'd agree with Dr. Barkley 100% that it is pretty straightforward on a medical treatment basis to say, you know what, methylphenidates or some type of amphetamine, and there are a variety of different combinations and ways of delivering the medication, but they're basically three medications for ADHD: an amphetamine, a methylphenidate, or a dexmethylphenidate, kind of cousin to the methylphenidate. Every other name of them are just different ways of putting them together. And whether they're immediate release or longer kinds of things. But for a doctor, that's pretty basic. Here you go.
Yeah,
Whereas
well,
antidepressants, there's a whole bunch of different ones. And is the depression part of bipolar, or what are the other factors? So it's much more difficult to find a good medication start to treating
and that
things.
makes me think of this other myth that I hate to hear. They say, oh, it's just drug companies wanting to sell their medicine. You don't hear that about medicine for diabetes. You don't hear that about medications for depression. You don't feel like the drug company has thought up of this illness just so they can sell a drug.
No, and
It's another very pernicious and harmful myth.
yeah, and I look at it as the drug companies are following the model of capitalism. That's they
Uh-huh.
see a need and you come up with something that can meet the need and you sell it. That's where Ritalin was the brand name in 1954.
Mhm.
Gee, what are we going to do about this? And observations come up to, oh, if they take this medicine, these people perform better. Let's make a medicine that we can sell.
Right.
So the condition was there,
Mhm.
and someone saw an opportunity to develop a product and sell it because it helped the condition. It's not the other way around. Drug
Right.
companies didn't invent
Right.
it to
No,
get more.
that would be a
Absolutely.
hard sell. We
Yes.
have this
Yeah, a
medicine.
very
Where's
hard
the
sell.
illness?
Yeah, yeah. Just let's say it's this and this and this. No, that's exactly right. So, how is it you think that girls with ADHD get missed in elementary school or early in their schooling? Would it
Well,
be
I think it's
what?
two things. First, teachers don't know what to look for. Probably their schools don't want to identify more children that need accommodations. But it's also what Dr. Mason once said is that the teachers are looking for the kids that might be trouble, that might have trouble in school, maybe the first couple weeks of school. And then they've moved on. They start teaching. And the children that have the inattentive type might not show up right away. You know,
Mhm.
we
Oh
can
yeah,
be engaged and pay attention when it's new and interesting, but after a few weeks of school, we might be the ones getting bored, looking out the window, not paying attention to what the teacher's saying. So we might if the teachers learn to look for us, they should look for us maybe a month after school started. And this,
So,
yeah, and the
um,
way that we think teachers could tell us is, well, you tell us, describe how they could recognize us, and I'll add things.
I'm going to intervene or add a sidebar here. Dr. Ted Mandelkorn, who practiced here in locally in the Seattle area for many years, at one point did some video recordings with patients of his teenagers, and he asked girls, do you daydream in class? And oh yeah, all the time. Would the teacher know it? Well, no, I'm not stupid. I'm looking at the teacher. Boys are the ones looking out the window, throwing spitballs.
Oh, oh,
Girls, I don't want the teacher to think bad of me. I'm looking at the teacher, but I'm daydreaming about wanting this
oh,
um, game or dress or what I'm going to be
yeah,
doing with
yeah,
my friends. So it's the mask, the behaviors is very uh, true, and I think
well, in a way,
goes all
you're
the way up
saying
and
it
down.
gets harder to diagnose the older the
Yes,
girl gets because she's learning to mask more and more. She's
yes,
causing
yes,
herself more problems, but she's hiding it better and better.
yes, and certainly, and this has happened so many times that a girl who's in 10th grade, she's getting very good grades, A's and B's. She has hardly any social contact. She's not doing any school activities.
Uh,
She's not doing anything else because she's doing homework till 1 a.m. because she's absolutely determined to get that done. Sometimes I think it's from perfectionism. If I get everything right, no one is going to notice that I have a problem.
uh-huh.
And having been shamed in first, second, third grade that you're dumb, whatever. And so then they get sleep deprived because they're up
Uh,
till 1 and they have to get up at 6:30. Boys give up at 7:30 and go play video
oh
games,
yeah. Well,
which
as
is
you
now,
said that, it just my heart starts beating, I guess, because I remember my dad when I went off to college. He said the only reason I got into this college is because my sister was there. And he made
mm,
me so fearful that I might um, not be able to stay in college that I didn't join any activities. I didn't
mm-hmm,
spend my
mm-hmm,
time productively, but I was too fearful to get engaged in stuff. And so
yeah,
my years in college were not later on I thought I would have enjoyed going to college in a city more, so there was more interesting things to do, but I was
mm,
fearful of taking on anything to do. I
yeah,
don't know if
yeah. And I think that's that's the case. Now, I'm sure there are boys that end up in the same boat. Usually,
yes.
and it's a generalization, more boys get into the video games um, and they get very good at certain games, and a lot of them think they can become a professional gamer,
Ah,
which is actually there are tournaments, and you can, if you win it, get 5 or 10 or $20,000, and you get sponsorships from Game Corp. There's all kinds of things. One of my patients out of
oh,
probably 1,000 children I've seen, one is doing fairly well as a gamer. He has a part-time job that helps him earn money that he contributes to the family funds to because he lives at home. But it's very difficult. And hey, video games are more interesting in doing math. Absolutely. And I think partly because of COVID and kids being at home, that's the only way they could communicate with friends.
uh-huh,
So people will say, yeah, I talk with my friends. Well, what they mean is they're playing a game and everybody is in different places and they're on chat all the time.
right,
Oh.
yeah. Well,
So that's that
back
masking
to
again.
talking about
And
how the
going,
inattentive types and the girls could have been diagnosed. What they tell me is besides the dreaming, the teacher could pick up on things that they're always asking a neighbor, what page are we on? What
Mm-hmm.
did she just say? They might hand in the work incomplete because they didn't realize they should do the backside. Their
Mm-hmm.
desks,
Mm-hmm.
their desks could be very messy. They have poor penmanship often. Um, they Some of them might be wiggling a part of their body all the time. They're restless. They
Mm-hmm.
want to get up and wander around the classroom. They want to leave the classroom. They're just
And
it's not like one thing. It's a complex of behaviors that
and
fit
that's
together to say
right. And
this
that's
child has variable performance. Some days
yeah,
they're on and
that's
some
exactly
days
the
they're
issue.
not. Some
It
subjects they
is. It's a
engage and
complex thing.
yeah. And
But and I think that's where the teacher has to know what to look for.
right.
So the teachers need to be educated and learn this is a significant problem for children and on into the rest of their schooling. Kids who are not diagnosed with ADHD, up to half of them won't graduate from high school. That's a serious
Oh,
problem. So,
that's an
yes, you want to catch people early, but it's that constellation is a teacher going to know? I think there may be systems to develop to help with that and notice that this kid does great with reading, not great at math because she doesn't like it. Things are always incomplete in only her math things. It may not be a learning disorder, but she's not paying attention. If she's asking someone where what we're doing, that's more labeled as, oh, you're talking in class and not looking at
ah
what are
ah
you talking about.
yeah,
So a teacher
yeah.
can see, yeah, you're talking in class all the time. That's what they get criticized or disciplined about,
Yeah.
but they don't know it's
Move that
asking
child off to
where
be
are
by themselves and they won't be producing at
they won't
all.
be. Yes, exactly. So it is a constellation of symptoms, and that's ADD in general. A lot of people say, well, yeah, all kids put things off, or sure, they want to play games or whatever, but it's the number of they're always losing things, always off distracted. They don't follow conversations
Mhm.
and they put things off and they don't follow through. It's got to have all those.
Well, it's interesting. I didn't know that about only half of them would finish high school if they aren't
Right.
diagnosed. But the reason I think when we hear that it's a public health problem is since we've learned that they die 12 years earlier. And
Yes.
how their life is to contribute to their death is they're committing suicide or they're
And
involved in substance abuse. They
and
develop
and
severe health
they're
problems. They
obese and they're not exercising
they're risk
and a number
takers
of
and they're
different
poor
things.
drivers.
And
Yeah.
a lot of it too is if you lump in the statistics of children under 5 with ADHD are much more likely to have emergency room visits, to
Ah,
have unintentional injuries. And I think if a child under 5, the second time they're in an emergency room with a serious injury,
uh,
that should be an
ah,
indication of we have to look and see what's happening
yeah.
because kids are impulsive
Yeah.
or think, oh, I can do that. And they're tiptoeing along a wall and they don't fall to the side where it's only 3 feet. They fall to the side where it's 10 feet. And so they break an arm.
Well,
Um,
when you say that about accidents, I think that it's true for the inattentive types as well for the combined
oh,
type
yes. Oh,
because
yeah.
I've had my share of accidents and I even have gotten bitten by dogs because I didn't realize I was annoying the dog.
Yeah. No, I think it's very true that not, not realizing the risk, not really assessing a situation
Mhm.
or just kind of falling into it
Well, and I think
and
sometimes we
not
don't
paying
know where
attention.
our body is in space. At least I,
Hmm.
because I would bump into people and have poor balance. I don't know if that's more characteristic of
There's
people with ADD, but um,
there is a subset of people with ADHD who have discoordination syndrome.
Uh-huh.
And I haven't seen recent statistics. I think from some I've seen a long time ago was about 20%
Mm.
of people that, yes, they bump into things
So
and
what
it's they can't, or they certainly aren't in sports because they
oh,
can't do those.
I see. Well, what I hear now is about neuroplasticity, and I don't think we know enough, but there's this. Do you think it helps in that way with early medication treatment, that it helps you to create new pathways as you practice new behaviors so that
I
it,
do, and my thought comes from some very early, that is early in the growth of the area. It's probably in or 2010, 2012, where the functional MRI and an MRI resolution got good enough as that technology advanced
hmm,
that they could actually measure the thickness of nerve bundles. And looking at children before anybody had taken medication. And then
ah,
3 years later, after they're
ah,
taking medication, some of them, the ones taking medication had thicker nerve bundles going in the directions that they needed to.
hmm,
So medication, my view, was helping those signals go. And it's a basic part of our body. You get more stress on a system. Now you're using a shovel all the time, you're going to get
uh-huh,
calluses. Your skin adapts. Well,
yeah,
you're sending these signals down this pathway, and
you're
boy, we need to
growing
have
that part of your brain.
more channels. We have to get this 2-lane highway up to a four
Yeah,
lane
yeah.
interstate kind of thing.
Well,
So I
I
think it's very real at medication.
remember hearing that people got upset. They said that medicine changes your brain, and that they were doing it as a scare tactic. And I was saying, yes, it changes your brain. It makes it
It's
healthier.
supposed to. That's the whole idea, because that it changes your brain to be more doing what it's supposed to do,
In
because your
healthy ways.
brain
It changes it in
wasn't
healthy
doing.
ways.
Yes, yeah,
Yeah.
your brain wasn't able to do what it's supposed to genetically. So it helps overcome that. Someone with diabetes, they don't have a choice to to make their blood sugar better when they are diagnosed with diabetes at age 8. And that's not from eating behavior, that's because their insulin producing cells gave out.
Mm-hmm.
So we give them insulin that compensates for the problem.
Mm-hmm.
You give someone with ADHD whose brain isn't sending signals where it needs to, when it needs to, medication that helps it go there, well, you're solving the problem.
Right.
So, yes, it's changing the brain. It's supposed to. That's
Mm-hmm.
the whole idea. And I think in terms of getting back to girls with ADHD, ADD, inattentive or combined, may be less likely to get medication again because it's not recognized, they aren't diagnosed. Uh, and I don't know that there's a bias against girls taking medicine versus boys.
Mm-hmm.
It's more in general, diagnosis hasn't been made. I think it's missed more in girls, and maybe they're better at masking it. Um, and so they don't get treated.
And as you say that, I think if historically women have always been looked on as the weaker sex with anxiety and all these problems. So you'd think we would, kind of be pampered and say, oh, you poor dear, you have this condition. Let's help you with medication.
Well,
But it's
the,
not happening that way.
no, well, what's diagnosed is, well, you're anxious.
Yeah.
Yes, this woman's anxious because she's not able to keep up with
Yeah, they
stuff for her
feel
kids
better
in school.
saying
Her
we're
house is a
anxious and
mess.
depressed.
Yes, and they go in to see a doctor because they're anxious and they're put on medicine for anxiety or
Yeah.
depression. And I've seen a number of women who have been on medicine for anxiety. They start treating their ADHD. They don't need the anxiety medicine anymore. They don't have
Right.
a primary condition of anxiety. That said, there are a number of people, 30+% of people ADD, also have a separate diagnosis of generalized anxiety disorder.
Right.
They may
Right.
need two kinds, but you're still even going to relieve some of that anxiety if you relieve the anxieties around poor performance from ADHD.
Yeah, I think
Um,
the whole area of psychiatry is going to be evolving as people end up with 4 and 5 diagnoses, and it's not. I mean, we're trying to define this, you're this way, and that you're where now that I've learned some about autism, I have a few autism behaviors, and you're saying I have a few of those behavior uh, balance problems, so we're individuals, and
yes,
it's just
exactly.
really hard to say. But
Yeah,
I
one
wanted to
a
give a
person
shout
isn't
out
just,
for my book.
yes, please do, which
Okay,
was
here we
just
go.
published a week or so. Absolutely. Living with a inattentive ADHD, which
Yeah.
is your personal story.
Yes.
Um,
Well, it's a memoir and it's a self-help book, but the where I think it is really valuable is in people who have family members who say you don't have ADHD, or they don't understand the broad impacts of this condition. I
yeah.
describe it. I describe in all the ways it impacted me in learning, in losing things, in my parenting skills, in burning things on the stove. I mean, just the whole range of stuff and how my life changed once I was diagnosed.
Mhm. Did you find there were some things, losing things, whatever, um, that medication and treatment, even strategies, didn't help?
I still have a poor memory. I don't think medicine helped my memory at all. And if there were one for that, I surely would take it. No, but
Yeah.
the other things, um, it's a process. It was a process. It's not like I
Yes.
was on a podcast the other day where her inspirational metaphor was a caterpillar that went through chrysalis and then came out as a butterfly. I said, well, that's great. It's one beautiful image. But for someone with ADD, I think it's not going to happen over 30 days. It's going to be a 3 to 5 year process that
At least.
not suddenly, but you slowly become this new person who
Hmm.
is very accepting of yourself, and who um, is in your areas of strength. So
Hmm.
your self-esteem, your self-confidence has blossomed, but it's not like an overnight thing just because you got
No.
diagnosed. It's a process.
And
And probably the same with diabetics or some other condition.
oh yeah,
There's a
accepting
lot
it.
of learning to do and a lot of
Yes.
changing in how you live your life.
And I think that's where, if someone is dedicated to making a difference for themselves and for others around them, then they can do that, educating and looking at, talking with people, what are the better ways to do things, learning strategies for it. But it also, for other many people, they don't want to learn that, or oh, medicine's going to help it. Oh, it's not working. Well, I must just be not good or defective, and I can never do this. And some people that say, "Oh, my house is just not organized, and taking medicine it doesn't work." And the person has come in to see me for 5 years, and the story is always the same. I can't get to bed on time. I always have one more thing to do because the house is a mess and blah blah. She's not looking at the things that really could help and just is kind of stuck. And I'm not sure how to help those people. Because someone who is interested in, yeah,
Ah.
I'm gonna maybe do some of the group things through ADA or other groups, or uh,
Yeah,
read
you
more,
have to have that
talk to people.
motivation, and I don't know where that
Yeah.
would come from to take. Well, what I wrote about is how I felt myself is to take one step at a time. Because I think where
Hmm.
people with
Little ones.
ADD attempt is they see so many things that are wrong, they try to fix them all at once, and then they're in
Hmm.
overwhelm and they aren't successful. But I say do one thing and get successful at it, and then you're ready to do the next thing. And
Hmm.
that's why I call it this climbing the circular staircase, because you're slowly going upwards, and you have to be willing to know that it's a process.
Yes, and it definitely is one step at a time. I've heard it said that neurotypical people may be more likely to take one step at a time on a task. People with ADHD jump into it and go everywhere at once. And that's where you get
They
very
end up
overwhelmed.
lost.
Yes, you end up lost and figuring, well, that didn't work, but you do take little steps. And unfortunately, we have to take the step of um, finishing up now. I'm sure we could continue conversations on the different aspects of the overall topic of attention deficit disorder, whether with hyperactivity
Yes.
and inattention, so-called combined, or just the inattentive type. Um, and we have talked about a number of things in terms of how the diagnosis can be missed, how important it is to make that diagnosis early. And I think the two groups of people who see a child when they're young are the parents and the teachers. And each group needs to learn more or be helped to learn more, and teachers particularly, so they can see some of the flag behaviors beyond just the hyperactive.
Yes. Yes,
So
that's a
I
good
applaud
message. That's a good
your
message.
efforts in educating people that yes, we need to screen children early,
Hmm.
and even if the screening results in saying, well, you don't have ADHD, it needs to be qualified that we can see at this time.
Yes.
And
Yeah.
if this and this and this keep going, then let's look at this again. And when you're in sixth grade,
Right.
um, to not give people this impression that, oh, see, I got screened, I don't have ADD, didn't show up yet. That's also certainly possible.
Yes.
Well, my guest today has been Cynthia Hammer, who is founder of Inattentive Coalition, Inattentive ADHD Coalition, and their website is iadhd.org. Cynthia's book, Living with Inattentive ADHD, also came out recently. And Cynthia, it has been a great pleasure to have you here on the program.
Thank you, David.
And take care, everybody. We'll talk to you next time.